Forgiving Retribution, take one. Yay! All right. Hi, everybody. Welcome to another behind the scenes video from the Forgiving Retribution production. I'm sitting here with Dr. Curt Samlaska, who's also writer, director, co-actor.
Yes.
And we've been kind of toying around with this idea of using behind the scenes as a way of really clarifying all the whys. Like, the whys are kind of important when you write something, what you write about, and the events that happen in that production are for a specific reason, right? So what I was thinking would be nice just to hear your specific reasons for certain things that you chose, as far as like the production itself, the content of the production, especially some of the areas that are maybe controversial or considered controversial, but they're important topics.
Sure.
So feel free to share away.
Well, one of the things that I've wanted to do with all of my screenplays and my script is I put them into competitions. I like doing that. I like to get the feedback. I get a lot of different professional feedback from various sources. And it's a real crapshoot. Sometimes, you know, it's right on and the people get what I'm trying to do. And other times I get triggered people.
Right.
And that's one of the things I really wanted to address with Forgiving Retribution, because this is a majorly triggering a short film.
Right.
From a number of different perspectives. One is from the understanding of what being a physician is. There's a lot of preconceived notions, you know, about docs and what they do and how they handle it and stuff. And I don't think a lot of people realize it, but it's what we do. It's a lot of responsibility, and we're essentially trained basically to save people, to make people's lives better, to make a medical diagnosis and to treat that underlying condition and make these people better.
Right.
That's what we do. And we're not always successful. And so the impact of that success or failure can have a toll. And it's not just, as one reviewer put it, PTSD, and why didn't he just get some help for PTSD? Well, first off, it's not PTSD. It's basically chronic responses to what we do on a daily basis. And we're trained all along to handle this kind of stuff. I sometimes think that it's difficult for some people to realize that these types of effects on physicians and their lives. I mean, the
toll that it takes on them.
Yes, the toll that it takes long term. I don't think a lot of people realize, but 200 to 300 physicians a year commit suicide. Wow. That's a very high suicide rate for any profession.
Yeah, that's huge.
Yeah, and you know, it was interesting because I showed my script to a retired thoracic surgeon. He's a good friend of mine, and he read the script and he said, you know, Curt, in all my years, I don't remember my successes. I remember every one of my failures. And that's kind of takes a toll after a while. I'm a dermatologist, but I am also an internist. And I had spent 14 years in the military. I started out in internal medicine, and I was chief resident at Triple Army Medical Center in Honolulu. And I was on staff there for another year before I decided to go on and do dermatology at Walter Reed. And so I was hip deep in medicine. I was a medicine guy all along. I've run 2 codes at the same time.
Wow.
I've had patients bleed out in front of me on the intensive or on the wards from a tumor erosion into a pulmonary artery that caused this rapid blood loss. I've had 15 admissions in 1 hour from a mass casualty that occurred on an island mission. You know, 3 young people ended up on ventilators and one of them died. So I've been there.
So the material you've written is coming out of truthful experience.
Yes.
So for someone just to make a review and a judgment on your life's work, you know,
to assume that they know how a doctor should feel and how a doctor should react, and realize he's got PTSD and he needs to see a psychiatrist. Well, docs are great at making diagnoses. They're also great at taking care of themselves, and they feel that they can manage a lot of this stuff.
Yep.
You know, and sometimes you have to be careful because you start taking care of your family, and you can step back and go, hey, look, okay, I'm not a pediatrician, so I need to have the pediatrician
Right.
address these issues. But there's always that tendency that we're docs, we take care of people, so why can't I take care of my own loved
Right.
ones? That kind of a thing.
And that's true, but also on just the human emotion side. I mean, yes, that's his profession.
Right.
But at the same time, as a human being, he still has to have a human reaction
Right.
to things that have gone
Right.
on.
Right.
And just like for me, I've had all kinds of stuff that have happened in my life, and I'm sure you have, where you could label it PTSD, but it isn't necessarily really PTSD because
Right.
every human being is different. Every
Right.
human reacts differently. So there's no reason why this doctor, the one that, the reviewer said something about, that he's clearly suffering from PTSD. I didn't
Right.
agree with that at all.
Yeah.
I was just like, this is a personal journey. His brain is actually manifesting this ghost or
Yes.
this vision of what has happened in his world, and it's up to him to make peace with that.
Yes.
It's up to him. Like, that empowers him versus constantly saying, oh, but you need therapy. You need
Right,
all these things.
right.
I'm not saying therapy isn't important and isn't good at certain times when people need it, but some people absolutely can fix themselves.
Right,
And,
and they
can make
can.
their
Right,
resolutions
right,
happen.
right,
And I
right.
think
And
that's a powerful message you send in this script itself.
And there's no person that's in a better position to do that than doctors.
Of course.
Doctor, heal yourself. You hear that kind of adage. One of the other objections that I got from one reviewer was, oh my gosh, obviously this guy is an ER doc, he's seen lots of death and stuff like that. Why would he fixate on this one case? It's just not believable that he fixated on this one case. And I'm going, that wouldn't really upset me because that's coming from someone who has no idea what they're talking
Right.
about. No idea what they're talking about. I'll
Right.
give you an example. When I was at Walter Reed, I saw a patient, a 21-year-old young woman who was a brilliant woman, has A student. She developed something called Lafort's disease, which is a rapidly progressive neurodegenerative disorders. And these patients, it's autosomal recessive, inherited. These kids experience seizures. She had her first seizure, I think it was when she was 12 years old, and then subsequently developed rapidly progressive. She was an A student in college, and within a year, she had full-blown dementia.
Oh my
When I
gosh.
saw her, she was 21 years old, and I actually published her case because you can make the diagnosis of Lafort's disease by doing a biopsy of brain tissue, of liver tissue, or we've discovered that apocrine glands or eccrine sweat glands actually can have the inclusions. And so if we just do an axillary biopsy, we can make the diagnosis basically on doing a skin biopsy.
Okay.
And save them from having a brain biopsy, which is a very aggressive thing.
Wow.
So I came to the ward, I saw this young woman. I mean, I was crushed. She was a beautiful woman, and she was dead in a year. And that particular case, I will never forget. It had a really big impact on me.
Yeah.
With seeing how rapidly a patient that young and that vibrant can just die from a disorder.
Oh, that's so sad.
It's very tragic.
Yeah. The other thing, though, of course, that is considered controversial will, of course, be the topic of COVID. So I was hoping you could kind of expand on why
Yeah.
COVID was
That was
important
another
to the project.
touching the third rail on COVID. I mean, that was another one that seemed to trigger a lot of reviewers. They're going, wow, why would you want to, you're coming across as an anti-vaxxer. And it has nothing to do with that. What it was is I wanted to tell a story, and I wanted to tell a story about a patient like my Lafort's case, a young patient that died prematurely, that had a significant impact on a physician. And this happens. And if you're dealing with a 16-year-old, there's not a lot of stuff that you can come up with that you could miss. And that was the key, was what diagnosis could I come up with that a physician could miss that would result in the death of a young individual prematurely because you missed the diagnosis.